Welcome, everyone. Give folks another minute to come into from the waiting room. Okay, welcome, everyone. I am Jamie Strauss-Clark, your facilitator, and this is the 26th House Bill 1477 Crisis Response Improvement Strategy Committee, and the last one that we have before submitting our final report to the legislature and governor. So today is a big milestone, lots to talk about today, and just want to extend a welcome to everyone. Before we get started, we do have our usual housekeeping. I realize it's actually been a minute since we did a Zoom meeting together, since our last meeting in September was in person. So I'm just going to do a quick reminder of how we work together on Zoom. Christine, can you pass the slide, please? All right, so everyone knows this. I'm going to go really quick. We have two slides, one for our CRIS committee members, and the subsequent one is for our community members and guests who are joining us today. CRIS committee members, if you could please keep your mics on mute unless you are speaking. Kristen, you can just click ahead there to show the mute button. There we go. And then click again. And please keep your video cameras on if that's available to you, particularly when we're after our break, when we do our discussion together. It just helps me facilitate and make sure that all of our CRIS members have an opportunity to engage. Click ahead, please. We use the raise your hand function. So if you would like to speak in the meeting, please click on that reactions button, opens this little window, click raise your hand. Of course, if you are having trouble finding that, you can also signal to me this way. If you would prefer to communicate in written form, you can use the chat button. Please send me, Jamie Strauss-Clark, a chat if there's something that you would like to communicate, either a question or feedback, and let me know in there if you would like me to say it out loud to the group or just keep it to myself, and if you would like it attributed to you. Click ahead, please. Reminder that you can click on that speaker view button in the upper right-hand corner and change it to gallery view, and you can see more of your CRIS committee colleagues there. Click ahead, please. Okay, and this is the slide for members of the public. A backup one, please, Christine. Members of the public, if you could keep your mics on mute for the whole meeting. The exception would be if you sign up to make a public comment at the end when I call on you to make a comment. Click ahead, please. And if you could please have your video cameras off during the discussion period. This just makes it easier for us to facilitate with the CRIS committee members. Click ahead, please. Again, you can change to that gallery view if you'd like to see more CRIS committee members. One last click. I think that's it. I won't be able, community members, I won't be able to respond to your chats during the meeting. So if you send a chat to me, I won't be able to respond. I'm going to need to focus on chats coming in from CRIS committee members. That said, if you do have any difficulty or need help with the Zoom, please feel free to send a chat to Christine Milana. You'll see that in the chat tools. And she's also the person to send a chat to if you would like to make a public comment at the end of the meeting. Before we go into our meeting objectives and agenda, I would like to ask our two of our legislators who have been instrumental in bringing us all together and getting us to this place, if they could say a few words of welcome and thank you to our CRIS committee members. So Christine, if you could take the slides down, I'm going to hand it over first to Representative Tina Orwell.
Well, no, thank you. And I really appreciate being able to address the group. It's been quite a journey, I'm going to say that. And of course, so grateful for Senator Dingra and grateful for all of you. This has really been a long project. It's a big lift. We're not done yet. And the things that really stand out for me, one, like the lived experience group, and Pasha, I just want to do a huge shout out to you. I know a lot of us have attended that. All the subcommittees have done great work. I really appreciate when I think about where our state is around 988 and 911 and all the subcommittee work that really brought our systems together and the co-location, the beautiful partnership with the tribes and how we're really moving forward and honoring the system that they would like to see in our state. So I just want to thank everyone. I mean, there's so much that has happened. So much of your time has been dedicated to be here or in the subcommittees. And I just want you to say I know sometimes it might feel like we're moving slowly, but we are moving, I feel like, in the right direction. And just again, want to say thank you to Jamie and everyone that's really helped facilitate these meetings.
Thank you so much, Representative Orwell, and of course, Senator Dingra.
Good afternoon, everyone. I'll just start by saying I can't believe we're here. When we started this, it was quite the task. It was a sheer power of will that this bill got passed in the first place. And the fact that we set up a structure that was unusual, and that we had a steering committee, a CRIS committee, subcommittees, and the way that was structured, a lot of people were very reluctant to support that. I had a lot of people telling me that this is not going to work. It's too large and has too many people involved. And I just truly want to thank the facilitators on really managing this large coalition of individuals and organizations, because without that infrastructure, we simply are not in a position to be successful, because infrastructure matters. And then I really want to thank everyone who participated. These are not easy meetings. The subject matter is not easy. The reading is not easy. But to see the level of engagement from everybody has been tremendous. And now I know there are people who have stuck with it from the beginning to the end, and that's commendable. I also know people who've come and gone, and that's really needed as well, because not everyone can be here for the entire time. But for whatever time they were able to spend in improving our system, that was huge. And I also want to say, as I reflect on all the other task forces and other groups that I've been involved with, what is extremely amazing about this group and what we have put together is the fact that everyone's rowing in the same direction. When this bill first started, I don't know how many of you remember the hearing in the House. And boy, that hearing, it did not seem we would get here. But then we had a different hearing in the Senate. But everyone really came up with a bigger value system that was beyond their immediate work. No one stuck to the work they were doing and get protective of that work. I truly do believe that everyone came in sharing the value that together we can make our system better. And, I present nationally on so many different issues. And while we are struggling in Washington, I cannot tell you how envious every single state is about the work that we're doing here. Next month, I'll be talking about mental health in Texas. And I got to tell you, I don't know where I'm going to start there. But all of you guys just make me so proud. And the success that we're seeing, the infrastructure that we're building, it truly is a testament to each and every one of you and the hard work you're putting in to have these challenging conversations, to stick with the challenges that government is. But I think each and every one of us have seen these improvements, and we continue to see them. So truly, I cannot thank you more from the bottom of my heart for your engagement, and your engagement from a truly honest place to improve the lives of everyone. So thank you.
Oh, your words were perfect, both of you. Thank you so much for taking the time to honor this moment in our process and for all of your work to get us here. Do you want to go back and make sure everyone's clear on what our objectives are for today and our agenda? So I'm going to ask Christine to put that back up. Oh, Christine's ahead of me. All right, so today our objectives, as ever, understand where we've been, where we are now, and where we're going in the CRIS process. A big part of today, as you all know, is to hear your feedback on the draft report to the governor and legislature. We're going to talk a bit about next steps for our CRIS committee, confirm action items and next steps, and hear public comment. And I realize we're missing one very key objective here, so I apologize for that, which is, as ever, as we've done in all 26 meetings, center our work today around the real lived experiences of people who've encountered the crisis response system in Washington. So skip ahead, please. All right, so we're getting through the second item on this list, welcome introductions, review meeting agenda. We're going to move into personal stories at 1:20. And then at 1:40, we're going to start our discussion on CRIS feedback on the draft and draft final report to the legislature and governor. And at that time, I'm going to ask Senator Dingra, Representative Orwell, Senator Warnick, and Representative Dent to share a little of their thoughts about the importance of this report and what they're thinking in terms of their priorities around behavioral health in the coming session. We'll take a break around 2 o'clock, and then we'll get back together and return to our discussion. This will be when we'll have a large group discussion so we can hear your feedback, CRIS Committee members, on the final report. Then at 3:10, we'll move into what's next for the CRIS, and Tisha Kirschbaum from HCA is going to share a little bit about that. We'll go to action items and next steps at 3:35. And then at 3:38, we'll do our public comment period. We've extended it since it's our last public comment period of this phase of work. And so again, community members, if you would like to make a public comment at the end of the meeting, please send a chat to Christine Milana. She will take your name down and I will call you in the order in which we receive your sign up. All right, advance the slide, please. Okay, just a quick reminder of where we've been. So it's been a busy year. This slide, I'm not going to go through every section on this slide because you've all seen this one before, but this provides an overview of everything that we did together in the first half of the year, from quality and oversight, and also focus on specific populations that are affected by the crisis response system. Skip ahead, please. All right, and then we had our Lived Experience Stories project in August. We got together for a wonderful time in person in September to discuss the draft policy recommendations that are the foundation for the report that you all have reviewed that we're going to discuss today. And then today is to review and get your input on that draft report. In December, the steering committee is going to reconvene to approve the final report so it can be submitted to the legislature and governor. And advance the slide, please. All right, so that's it for agenda and all those housekeeping items. So with that, I would like to turn it over to Bipasha Mukherjee and Kristen Wells, who are going to do something a little bit different today around personal stories. And Kristen, Bipasha, take it away, please.
Hello, everybody. So this time around, we weren't able to find someone to come in person to speak, but we did pick a story that really resonated for us from our Stories project. And so Bipasha and I are going to read through this submission that was sent to us as a written story. This was submitted to us by a father talking about his child, and it was sent to us at some point during that June and July period where we were collecting stories earlier this year. We've removed all of the identifying information from the story, but we still feel like it's a very meaningful story that we'd like to share with you. So here's what this father wrote to us. My story is unique. I actually did not know about the 988 system. I have a 12-year-old son, and he was diagnosed with autism at the age of 8. We started on his journey well before the age of 8, probably when he was about 2. We noticed that he had some quirks and struggles and began trying to find help for him. And we're told, kind of along the way, that there's just not anything that was able to be done for him because of his age. Like I said, when we started our journey, he was probably 2 years old. And when we really started trying to access some help, he was about 3, almost 4 years old. At the age of 4 years old, he started actively seeing a psychiatrist for medication management to try and control symptoms with medication. And as we went along, we were told, he's too young. We can't diagnose anything at this age. I always thought that maybe he had some bipolar challenges or some kind of schizophrenia type of things, because he would go on these major long episodes where it just seems like he was not in the same world that we were in. I mean, just like what we thought were night terrors. I mean, huge fits of rage and then huge depressive states where he would say that he was bad, that he didn't want to be alive anymore because he was so bad and he didn't think he would ever be able to be happy. And as we were trying to help, all we were ever told is, oh, he'll grow out of it. You know, this is just kind of a situational thing. At the age of 8, we found out about the BEST program through Sacred Heart Hospital here in Spokane. And we enrolled him in that program where he was diagnosed with autism, with obsessive compulsive disorder, with sensory processing disorder, and mood dysregulation. We call him our alphabet sweet child. And so we kind of continued on the path. He got exited out of the BEST program because of behaviors and being extremely violent. And so we left there and just continued to kind of struggle and muddle through the system till we got him enrolled in WISE services with a wraparound team, probably at the age of 9, I want to say. And we were in WISE from age 9 until he was sent to CLIP this last October. He's been in CLIP about 9 months almost. And then while we were kind of in this period of waiting, he's in and out of emergency rooms, in and out of short-term inpatient facilities, in and out of treatment and therapy programs. We tried community resources for social groups, and he was uninvited from all of them because of his aggression and his behavior. And meanwhile, just kind of spiraling into this deep, deep kind of depression, where he was just thought to be the bad kid. So he kind of got this mentality and state of, well, if you think I'm bad, then I'll show you bad. And we were in the year prior to him going to the CLIP facility, spent probably almost 40 days sitting in Sacred Heart in their emergency room. Well, their psych emergency room, you know, the 3 or 4 rooms that they had at their pediatric ER, with him sitting in a little block and not receiving any therapy, but being told that that was the only way that we could access a higher level of service, to sit and wait for an opportunity or a bed to open up somewhere in the state that could accept him. But we were also told that, you know, we could sit there and wait and it would never happen. We were never offered any of the services like 988 or the crisis management workers or any of these other community resources and kind of helplines to help us as a family or to help him feel heard and understood. We were always just told, oh, there's nothing, you guys. We were always sent back to the same resources that we had already accessed over and over and over. And we didn't know about any of these levels of higher care until finally, one day, our son was out at a social group at Frontier Behavioral Health and had an episode. He loped out of the building, took a rock, and smashed the window of the director of Frontier. Her car was parked on the street, and he threw a giant folder through her windshield. And at that point, she's like, why is he not accessing, you know, things like CLIP or family-initiated treatment? Why doesn't he have a crisis plan or any of these things in place? And we didn't. We had one through WISE, but you know, that's a 9-to-5 service, and he was not a 9-to-5 crisis kid. We were a 24-hour crisis, and we didn't have access to any of these other things, knowing about 988 or about MRSS, which was beginning to roll out during that time in Spokane. And we didn't have any of those options because we just didn't know.
And I don't know if the community providers we were working with just dropped the ball or if they didn't know either. And it seemed to us like everywhere we went, there was just kind of like this confusion on what the information was. The answer we got, oh, I'm not sure about resources. I have to check with this person. And then that person would say, oh, I'm going to have to double check with this other person. And it was always like a ball being passed from one person to the next until finally we had kind of reached a point where we had been struggling so long to try and keep him in our home and in the community that it caused a lot of damage to relationships, to family, to siblings, to, I mean, obviously property in our community and repeated instances. I mean, like I said earlier, he had been in the hospital, I want to say over 40 days throughout the year before he went into his CLIP facility. Interaction almost on a weekly basis with the police in our community. And I mean weekly to the point where me and my ex-wife were on first name basis with the officers that would routinely respond and deal with him. We were hoping that, okay, now that we have law enforcement involved and now that, you know, he was arrested at 10 or 11 years old, and now that he's had this involvement with the legal system, There's finally going to be something that they can do. There's finally going to be something that we can go before a judge and plead our case and say, we need help. And we'll finally be able to get mandated into a program, and he'll get placed somewhere where he can get help. And that was just not the case. We were always told that's not what the system is for. And now, you know my journey. I'm hearing about families in my journey that do have, court-ordered treatment, and there are different struggles with families. And I understand that there are, the guidelines or restrictions or rules, but I see them as barriers. And what was the frustration with us as a family? Just there seemed so many barriers in the way to receive simple help, to help keep him safe, to help keep our family safe. And it seemed like every time we cleared one barrier, there was another one right behind it. And there was not a way to overcome those, And then finally, someone mentioned CLIP. And so we got our son through the application process. And thankfully, there wasn't much of a wait. We applied. And from the time we applied until he was in the CLIP facility was probably 3 to 4 months. And then we got in there, and they're asking us these questions about resources and the other things that we had asked. A lot of things that they were talking, we just had never heard of, and we had never been able to access. And so there's just this frustration of the ability to receive accurate and helpful information. And now that I've become more involved with the system, I know that information is there. And so my mission, I guess, in sharing my story is to help drive change so that we can help families know that there is help and know that there are these resources that will hopefully help early. That obviously, the mission is to allow early stabilization while at the beginning of the journey, and not to go through all the heartache and the struggle and challenge that comes with going through, being restrained, because you're having a psychotic break in the park and attacking your mom, and someone calls the police and they have to strap you onto a gurney and get you to the hospital so that you can be safe, or where you're, so upset that you kick a window out of a car and cut your feet. And then when the doctor's trying to stitch your foot, you rip those stitches out because you're in need of help that's just not being provided to you. And there are people, kids and adults and everyone in between having to struggle. And these are things that are not their fault, that can be helped if they have access to services that they need. So that's my mission, to share my story, to help these families access the care they need. So thank you for the opportunity. Thanks, everyone.
Kristen Vipasha, that was beautifully read. Thank you for sharing that and for all of the work you did to curate and find a story that would be resonant today and important to share among so many important stories. And I also just want to acknowledge that the two of you have done a tremendous amount of work over the last years to bring lived experience and these stories to the center of this work. I have watched how much effort you put into it, both in terms of finding the storytellers, but also preparing them for these meetings and helping them be comfortable telling a story, or as comfortable as possible in telling a story in this setting. So I extend a tremendous amount of gratitude to both of you for all the work that you have done to make this possible. So big applause to both of you. Okay, we are actually a little bit ahead of schedule here, so we're going to move now. And before I move on, I do want to thank Carol and Amber, our ASL interpreters who are here today. You'll see Carol currently pinned to your screen. They will be switching off as ever every 15 minutes. So I think Amber will be pinned shortly, but just keep an eye out there if you need ASL support today. All right, we are going to move into the first part of our discussion on feedback on the draft final report. And what I'd like to do before we actually start to hear from CRIS Committee members about your thoughts on that report is to hear from Senator Dhingra and Representative Orwall. First of all, about the importance of this report and its relevance to the legislature. And then I'm going to ask everyone, Senator Dhingra, Representative Orwall, Senator Warnick, and Representative Dunn to share some of your legislative priorities that you're thinking about for the 2025 session. I'll note that Representative Dunn emailed me and said he's going to try to be here by 2 o'clock. So I may kind of make time in the middle of our discussion for him to share his priorities once he arrives. But I'm going to now hand it over to Senator Dingra and Representative Orwell to share a little bit about how this report is used in the legislature.
Thank you so much for that. We get a lot of reports. I'll start off by saying that. So I always love the executive summary. I always love reports that are very specific on what action is needed, because that is critical. That is what people flip to see what those recommendations are. The other reason why reports are really important and the recommendations are really important, because it signals to the rest of the legislators that there is a group or community behind it that is supportive. So that coalition that is behind that report is really important. So when we're taking a look at policy, bills, fiscal asks, when we want money, and if we can say that this is a recommendation from this task force, and then these are the people engaged in this task force, that carries weight. And so at a minimum, I'll say this is why it's important to have these reports. This is why it's important to have these recommendations. And again, as much clarity as we can have in these reports and recommendations is highly critical, because it does show the gravitas of the work being put behind there. So I will stop then, let others talk about why they think this report is important, and then we can start talking about some of the legislative priorities and what next session looks like.
Thank you, Senator. And I agree. And I think the fine point for me this session is we might be going into a tough budget year, and it's really important to keep the work we've been doing on the front of the radar, continue to highlight why it's so important, and really be able to elevate your recommendations and resources needed. So it's very timely going into this next session, especially as we talk about next steps. So I think executive summaries and anything visual is really important for legislators. But again, this group is impressive, and I think for them to realize how many people came together and have been working on it will carry a lot of weight. So I think it's very timely. Thank you.
Before we move on to legislative priorities, any questions from the CRIS for any of our legislators about how this report is used? Kashi.
Thank you. Apologies for being off camera. I'll be on in just a few minutes here. My question, especially given Rep. Orwell, what you just shared about the tough budget year that's coming, is I did take a quick look at the report, and there's 22 recommendations in the executive summary. Just realistically, should we be paring down, or should we be prioritizing in some way? I just have a hard time imagining we're going to get all 22 things, and I'm wondering how to be pragmatic and strategic.
Very good point, Kashi. I do think if there's a way to maybe even identify of the recommendations what your top 3 or 4 are, that's always really helpful. Again, I don't know if they all I have to remember if they all needed legislative action, but clearly, I think if you can go in with a priority, that would be really helpful. What do you think, Senator?
Yeah, I'll just add, I hate negotiating against ourselves. And so I think we should always make sure everyone knows what all the priorities are. I also think we have to have a priority section within the priorities. These are the 3 that are the absolute. If we had to pick, these are the ones we would pick. So that level is critical and important. And I'm going to be a little bit more I don't say strict. I just want to be a little bit more pessimistic than Representative Orwell. She said we may. We're not. Our budget is not in a good position. And I'll give you 2 minutes in a very short form way of why, right? During COVID, what happened? Everyone stayed home and bought things. We are a state whose budget runs on sales tax. So thank you to everyone who bought all those chairs and bought all that furniture and redid things in their homes and their apartments. All of that spending increased our budget. Last year or 2, all of you people have been going out traveling and spending money out of the state. So we saw our budget going down. So in a nutshell, obviously it's much more complicated than that, but that is really why we are seeing that drop in revenue, because we are the most regressive, actually no, we're second to last regressive tax structure in the country. Mississippi's 50, we're 49. And so these are some of the things that happen with having a tax structure that is so regressive. So the reality is that we are in an extremely tough budget session. And so it really has to be, I'm talking about maintenance, making sure that we continue to fund everything that is already in the budget. So we fight for maintenance. I'm not even saying that maintenance is going to be automatic. We fight for maintenance, and then we fight for new. But that fight for maintenance has to also occur, because that is not a given across any programs in the state. And I'm not exaggerating. I truly am not. That is where we are, unless, of course, there are revenue options on the table. But we are fighting for maintenance and then trying to identify what expansion could possibly look like.
It was a great question, Kashi. I'm going to, for a moment, take off my facilitator hat and put on my hat of being someone who helped write the report. And Nicola, if you want to jump in here, I do want to acknowledge, actually, this is partly my facilitator hat too, but I do want to acknowledge there are a lot of recommendations in there, and reaching consensus in this group on top 3 or top 5 recommendations is probably not a realistic expectation. And so Senator Dingra, Representative Orwell, Senator Warnick, if you have thoughts to throw in here about how you might look at this and think about what, and I heard Senator Dingra saying we have to prioritize maintaining what we already have, but how you might look at what the CRIS has done and say, okay, here's what we need to focus on in 2025, and here's what we might need to hopefully focus on in the future. Please feel free to jump in and share any of those thoughts.
Well, Jamie, this is Senator Warnick here, and I would like to join in with what Senator Dingra just said. I've heard over and over and over about the tough budget cycle that we're going to have going into this year. And she talked about maintenance, maintain what we have. And that's what I wrote is we have a fantastic beginning with this group. We do. We have a fantastic list of priorities. And hearing from the gentleman that wrote the letter makes me want to do more and more and more for families like his. And it's interesting, he's from Eastern Washington. He was able to get some services, but at least he sounds like he's from Eastern because he talked about Spokane. But I wrote down, stay the course. Do what we're doing now. Don't add a whole bunch of new programs, because I think we are starting some good discussions, starting some good recognition about what is needed. And we can do that. It may be difficult to set some priorities. It really may be, but I think if we can focus on especially on our young children, those that are not, and the families that are not able to receive the services, if we can stay the course there, keep moving in that direction. Somebody wrote everyone moving in the right direction, or said moving in the right direction. If we can keep doing that without adding a whole other lot of programs, that will help us save not only our children, but our families and our state some much needed revenues. So, and I know Rep. Dent is just so disappointed that he's not here right now. He will be here. He's been texting me. He might be here a little after 2. He had made an appointment thinking this meeting was yesterday. So he called in yesterday and they said, no, it's, so anyway, it's one of those days, but we're looking forward to to staying the course and, you know, at least my thoughts. So.
Well, thank you, Senator Warnick, and I really appreciate you so much. We've had several meetings recently in Eastern Washington, and
Yeah.
so I was going to say we should add something in Eastern Washington, but but
Yeah.
you know, the one thing around staying the course that I think is really a priority for this session is we have these wonderful call centers, and we know that their volume may increase, right? And they're taking the, you know, transferred calls for 911, and so we have a dedicated fee, and I think making sure that they're prioritized first for that fee, right, to keep that part of the system working and working well, I think is really important, as well as is funding the co-location with some of the 911 centers. I think the other things that kind of jump out for me, I'd say three things. One is I just really feel like the CRIS Lived Experience Committee is incredibly important. And I've just really want to hear from that committee and see how we support it moving forward. Having a continued role, I think, is really critical in our system. The other two things is one, the agriculture system, because I've learned a lot and I have more to learn, but it seemed like maybe there's some very unique approaches when we're talking about especially farmers and how they team up with a clinician like an MSW and maybe someone that can help out on the financial issues they might be facing. So I just have been hearing from my colleagues, and of course Representative Dent will be here soon, about maybe things we could be expanding in that arena. And the last thing I would mention that I've talked to a couple of my colleagues about is whether the state, maybe using some of the climate change dollars, should be investing in electric 988 vehicles. So we have an alternative to transport people on our rapid response teams so that they can be, you know, if they need to be taken to a treatment site, can do that in a vehicle instead of, you know, in the back of a police car. So I think, you know, again, I think we have to be pretty strategic. And I would be very interested as we go through the discussion today, you know, if members can really highlight, like, please keep this as a high priority. Again, I think we've all been talking about youth, and I know a lot of us are working on getting more mental health in the schools. And you know, my question for all the great people working on this is, how do we tie this 988 in our crisis teams for youth to the schools? And I think we need, you know, all of the people that really know those services to help us make those connections so that we're doing things as effectively and as efficiently as possible.
Thanks, Rep.
And I'll jump back in and thank you, Rep. Orwell, for mentioning agriculture. I did not, because I knew Rep. Dent wants to take that. You and I have been on that committee with him, but he will speak to that as soon as he's here. So thank you for mentioning that.
So, you know, I'll just jump in and say, I think it's really important, and I've said this before as well, to make sure that we're taking a look at policies that cost a lot of money and policies that are needed to make systems work better that may not have a huge fiscal cost. And so I know some of the things that many of us are looking at is taking a look at licensure for behavioral health professionals, making sure that people are able to perform their job at the top of their license. And so also making sure that we can find other people to maybe fill in on administrative tasks that they're doing. So basically how to streamline a lot of the work and make sure that people are doing the job that their expertise allows them to do so. I know that there was a bill last year on giving psychologists prescription power. And, you know, this comes with additional education. That bill is going to be back. So, you know, these are bills that don't have a fiscal note, but can improve access to individuals struggling with severe mental illness. So that's just one example of what we're taking a look at. You know, we're taking a look at people interested in taking a look at our civil commitment statute, taking a look at updating our hate crimes, taking a look at you know, PTSD presumption for disability, things like that that are adjacent to all the work that we're doing, but may not necessarily have a huge fiscal note to begin with, but can help improve the lives of individuals. I still think we need to go forth and pursue everything we can, but I just want to set expectations on what might be possible to get across the finish line. So I'm very excited that each region is going to have to come up with their own crisis plan, making sure that we are submitting that to the legislature, to the agencies. I think there's an opportunity for us to really take a look at what that looks like in each region, be involved at that level to see if there's advocacy that can be done or really understanding systems at different levels. I do think that we can anticipate cuts to any federal dollars when it comes to accessing healthcare. I suspect federal healthcare subsidies will go away or be greatly limited. So we are going to see an increase in individuals that are uninsured. I think we as a state have to figure out how we're going to handle that. To me, that translates into needing more crisis care. So really thinking through how do we try to build that capacity for, or even trying to prevent more people coming into the crisis system, but that might be one of the realities. I'm concerned about federal cuts to our education system and what that means for our students. And again, what that means for them needing more mental health services. So there's a lot for us to really think through how the federal administration is going to impact the quality of life of individuals in Washington. And I am greatly concerned that access to healthcare, access to mental health services, education is going to be dramatically, gosh, so hard to find the right words, limiting. And I think we as a state and this group has to think through what that looks for Washington, because I don't think any of us want to go backwards. And this is why I'm talking about maintenance, because that maintenance that we're talking about is going to be a lot more expensive because we're going to have to supplement the loss of federal dollars. So to me, a lot of my legislative work and priority next session is going to be simply around the fiscal component in trying to do maintenance while anticipating federal dollars being removed from our state.
It's tough news to hear, but I appreciate your candor, Senator Dingra, Senator Warnock.
And I'm just depressing myself, and I'm so
Yeah,
sorry.
no.
I just want to make sure we all understand the realities of what we're looking at.
Yeah, and I don't think anyone's under any illusions, but it is really helpful to have you lay it out. I did get a note in the chat here that I want to kind of paraphrase and hear, and if you want to marinate it in a little bit and respond at some point. The concern that was raised, so recognizing that what you're talking about the realities of these budget constraints, but also raising a concern that maintaining what we have when we've worked so hard to center equity in this work, and Senator Warnock and Representative Orwell both mentioned agricultural workers and the agricultural industry, for example, which we know has the highest suicide rates in the state. The thing that's concerning about the maintenance approach is maintaining funding and sustainability for the most served already. And ideally, in this note, ideally in a budget constrained time, we double down on equity and potentially reallocate funds to serve those who have been overlooked. I'm curious, and again, please feel free to marinate in this a little bit if you want, but or if you need to, but I'm curious what your reaction to that is, if you agree with that, or if you have some thoughts on how we could creatively approach that.
I'll just say this was the fight we had during COVID as well, right? Where we were really trying to figure out how the most marginalized in our state, who were going to be most impacted by what was happening, don't further fall, or the disparities don't continue to grow. So I think this is always something we have to grapple with. And I don't have a solution or a thought around it, because it's very hard to take something away from someone and give it to someone else. And while we want to really be data driven and really make sure we are uplifting the most marginalized and the most vulnerable amongst us, I do think that is the goal of government, is to help the most vulnerable and the most marginalized. And I think we have made a lot of strides in even that identification of how we have not been meeting different communities' needs, that we have not even been able to identify properly who these communities are and how to do that outreach. So I'll just say I hear you on that. It is something I grapple with on a regular basis, and any concrete solutions would be greatly appreciated.
Thank you for that. I see Representative Burwell came off mute too there.
Yeah, no, I think it's an important dialogue. And, you know, one thing I'm so proud of is the first thing we set money aside for when we got the fee passed, thank you, Senator Tinker, was the Native and Strong line, right? And we're making sure 25% of our rapid response team. And I think, you know, it's like, I think like the tribal recommendations, they should be prioritized. I think that a lot of the work we're doing right now with students in schools is to make sure behavioral health, especially the workforce that reflects the diversity of the students, is really going into the school. So I think we are trying to look at everything with an equity lens. And so when I look at the fee, and which I'm very grateful we have, I think we need to make sure we're being as efficient as possible with anything on the IT side and converting as much of that money as possible to the clinical, to the call centers and the clinical staff. And we got to find that sweet spot, right? And so I just think it's going to cause us to, you know, just look carefully, right, at how that fee's spent.
Thank you, Representative Orwell. I do have a note in the chat here. This is from Puck. And they say, we began this process discussing a system redesign. So this is an interesting place to be semi-concluding. And I can see in looking at other CRIS members' faces on the screen that many of us are feeling that way. Other questions for our wonderful legislators about what they've said about the budget, their priorities coming up? Anything to add or respond to there? Okay, and I just want to make a note.
I'm sorry, can I just,
please, go ahead.
respond to that? I'll just say, I think the changes and the improvements we've made over the last few years, that is maintenance for me, that we continue that. So I don't want this to seem like we are going backwards. I think we're just not able to advance as fast as we want to, but I do want to acknowledge that we have made great strides in the last few years, and that work will continue. That work will continue to change people's lives. And you know, who knows? Maybe something amazing will happen and our budget will improve and all of you guys will go shopping and buy lots of stuff. I don't know. Or maybe we pass progressive revenue and that can help. So, you know, there's always hope. Hope springs eternal, but I don't think we should lose sight of the fact that we have made progress. That progress is here to stay. We just may have to take a breath. But I think all of us here are committed to continuing this work.
Thank you, Senator Jingra. I see some hands here, so let's go with Bipasha, followed by Kashi.
I think I will second if we can move up the regressive ladder from 49 to a little further up. That would be, I, as a community member of the state, would be very much in support of that. So I agree. I wanted to say, you know, thanks Rep. Orwell for bringing up the lived experience subcommittee. I did want to say that I think this is part of the leadership y'all showed in putting that into the House Bill 1477. And although I have served on that committee, I by no means identify as one of the most marginalized people in the state. So I will just be honest about where I stand. But I've heard over the past 3 years from a lot of people. And I think it's really important that the voice of the consumer be a very strong part. And I want to echo what Jamie read earlier, which is when, you know, things get difficult, we often sacrifice the voice of the most marginalized. So whatever we can do as a community to keep these voices in the mix. And this happens to be behavioral health, but it can impact housing, it can impact criminal justice, it can impact all different arenas where lived experience are, in every arena. So thank you for mentioning that. And we'll see what we can do as a community to work with you all to see if the lived experience voice can continue to sort of inform this process. So thank you for that.
Thank you, Vipasha. Kashi.
Thank you. And Senator Dinger, I think you gave me the best possible excuse for retail therapy. So that helps me, I think, a little bit. I do think my feedback sort of in response to that, and I appreciate the realism, right? Like we have to know what we're walking into and what we can and can't do here. And so maybe this is jumping ahead to the feedback about the report, but I do think there's ways to structure this so that it's clear where who these recommendations are to, right? Some of these recommendations are actually to the HCA about how some of this work should look moving forward. And some of them are recommendations to the legislature. And if all 22 of these don't need to be addressed by the legislature, like let's help ourselves in saying that like these are the things that we really need the legislature to address, and we really were thoughtful about this process and wanting to make something move forward that's successful, recognizing the landscape we're walking into. And I just appreciate the reality that we have to live in, even if I wish it was not the case. And I think there's an opportunity to set ourselves up for success with this report. So maybe I'm jumping ahead. Sorry, Jamie.
No, that's perfect, Kashi. Actually, when we get to that, I'm going to make a note of that we talk a little bit as we're going through about feedback about how we might be more specific to your point about who we're asking to take this action. So thank you for that. Any other comments or feedback for our legislators or questions? I have a note here. Michelle Roberts with DOH. One thing that might also help inform our conversation is I understand you might be able to share a little bit about budget requests from DOH for the coming year to kind of help set some context. And anything you want to jump in and share on that?
Sure, just give me 1 second. I am Tisha and I are both at a conference and I'm trying to go between different places only on my laptop. So I'm trying
Do you
to
need
move.
a few minutes? Because I didn't mean to put you on the
No,
spot.
I'm ready. Sorry.
Okay.
Yeah, no, I'm not going to highlight all of the agency requests, just like the information our state legislators were just sharing. Each of our state agencies is, all of us have our requests into the governor's office, and also there's other work at the moment happening, thinking about just the reality of the budget situation we're all going into. So one thing I do want to share is that we do have a 988 request. That's the ongoing funding to continue to support the call centers in our state, the 988 call centers. So the statute and the legislation that had passed requires the department to provide adequate funding for the Washington's 988 call centers to have an in-state call response rate of at least 90%, which our call centers are doing a great job at, and to continue to meet the increase in demand as we continue to advertise and think about what calls do we want to be shifting from other places to the front door of 988 to help the system. So we do have a request to make sure the funding needed to maintain the 90% rate for the call centers, a funding request in to continue to support that growth and stability for the 988 call centers. And I'll just leave it at that.
Thanks, Michelle, and thanks for jumping in from your conference. I appreciate it.
Yeah,
Okay,
problem.
and I know Representative Dent, what we're going to do is when Representative Dent joins, we'll make some time for him to share a little bit about his his priorities, legislative priorities for the coming year. In the meantime, why don't we're still running a little bit ahead of schedule, so why don't we go ahead and start diving into our feedback from the CRIS Committee about what you saw when you reviewed the report to inform kind of the next iteration that will go in front of the steering committee for their approval in December. And then we'll work in a break maybe after Representative Dent is able to share a little bit about his legislative priorities. So I'm going to ask Christine, I had a couple of prompt questions that we sent out to you to think about in your review, and Christine's going to put those up on the screen. All right, so questions we asked you to consider. What feedback do you have on how the recommendations of the CRIS are presented? And Kashi got us started on that by mentioning that it could be really helpful given the volume of recommendations in here to be specific about who we're asking to do these actions. Another question for your consideration was, as you hand this report off to the governor and legislators to take action, do you feel like the content conveys the CRIS's recommendations effectively? And if not, what changes would you make? What is one message you would like every reader to take away from this report? And then we'll cover this last question here, which was more of a kind of recognizing where we are in this process about your thoughts on the CRIS process. We'll save that one for closer to the end of the meeting. Right now, I'd like to focus on these first three questions. So CRIS committee members, you've had a little time to review the report. Hopefully there weren't a lot of surprises in there. Hopefully these recommendations looked familiar to you. Let's see if anyone wants to kick it off on these three questions I have here. Feedback on how the recommendations of the CRIS are presented. Does the content convey the CRIS's recommendations effectively? And if not, what changes would you make? And finally, what's one message you'd like every reader to take away? Kristen, please get us started.
Yeah, so this is kind of building off what Kashi had talked about earlier. We have with our feedback kind of the progress that's been made for each recommendation. I think it could be helpful if we came up with a system to make it clear where those things have happened, if they've been in the legislature, through the Department of Health, through HCA, because if we have a way to show that through formatting, color coding, something, we can see where progress has been happening for each recommendation so far, and that might help guide us to where we're asking for further work on that recommendation to continue happening.
So Kristen, I just want to make sure I'm tracking. So in the report, there's the recommendations and there's the progress to date. And you're saying if we can actually, in the progress to date, also be clear about who's making that progress, that would be helpful too.
Yeah, if we can see where things have already been moving for each recommendation, that can help give us a better idea of where things need to continue towards that recommendation, since for most of them, there's already been something happening. So for instance, if we can see that the legislators have already passed a bunch of bills related to a recommendation, that might tell us that the next step is for HCA or DOH to implement what the legislators have passed so far.
Okay, I'm going to keep pressing here because I'm not sure I'm totally tracking, because the report does actually list the progress on each recommendation. So maybe help me understand how you would want to modify that.
Just a way to make it more visually clear, I think, because it's all text-based, and maybe using color or bolding or some sort of outlining, just so that it's at a glance easier to see which of these things have been addressed by which part of our government so far.
Got it. Okay. Thank you for bearing with me there, Kristen. I appreciate it.
Yeah, of course.
All right. Other feedback from CRIS committee members on what you saw there. Kashi.
Okay, I don't want to belabor the point. I think that what I want to communicate is that the categories of recommendations, especially in the executive summary, are in categories that make sense to us as the people who have been doing this work for the last few years. I just am not confident that those categories translate to other readers. And if the report is intended to catalyze action by other players, I think those players need to know what action is being requested of them. And so my ask would be to take those recommendations and perhaps retain the category or the theme they meant to us by some sort of chart or something, but organize them in a way that it's clear who the action is being requested of. And I think there's varying levels of specificity or granularity for each of these recommendations. So some of them are incredibly specific. They tell you exactly what to do and how you should do it. And some of them are general principles, right? Like engaging consumer voice in the building of this process. And that I wonder who would implement that and how they would do it. And that would be my ask, is to make this more easy for someone to read it and walk away understanding this is what's being asked of me by this group of people who spent a lot of time thinking about the crisis system.
So Kashi, if I'm taking your meaning, so for example, in the, like, we have an at a glance recommendations, if rather than by like cross-sector collaboration, or it says actions for the legislature to take, and it lists the recommendations specific to them, and then actions for Department of Health to take, and it lists those. Am I tracking you there?
That's my idea. I saw Senator Dingra's hand go up, so maybe she's about to correct this, but I've never written a report like this, so this is my caveat. But I think that cross-system collaboration means something very specific to me as someone who's attended all of these meetings. But you don't know what that means if you have never thought about behavioral health, for example. And I'm wondering if this makes it more, yeah, actions for the legislature, actions for agencies, actions for specific commissions, or things like that.
And I see this echoed in the chat here from Puck, directing this at the legislator, making it clear to them what their action steps would be. So sounds like you're echoing Puck a little bit of what Kashi heard, or Kashi said, and adding to it. Senator Dingra.
So I was not going to correct you at all, Kashi, because I think you're right on. I actually wanted to combine what both of the first two speakers have said, and I was looking. Sorry, I have the recommendations on a different monitor. But taking a look at committee recommendations at a glance, I actually like that it says promoting equity, service, prevention, all of that. But I think right next to it, develop a call a Bill of Rights. I don't know if parentheses we say legislative ask, and then to the earlier point, maybe that's where we color code it. So that's a different color. So the next one, when you're talking about ensure equity in the services, do we do Department of Health, HCA, and then color code it so we know, so people from DOH can just look for their color and then know exactly what their to-do list is. People from HCA can take a look at their color and know what their to-do list is, and the legislature can do the same. So I agree with both, and I think there is that opportunity in the committee recommendations at a glance to really provide that very concrete to-do list.
Excellent. Okay, so I'm hearing overall support for making this much clearer for the intended audience, which is our legislators and the governor's office, and the folks that we're asking to take action about what specifically we're asking them to do, and using visual tools like what Kristen was suggesting, color coding or bolding or formatting. All right, Michael.
Thanks, Jamie. Can you hear me okay?
I can. You sound great.
Okay, thanks. No, I agree with all that, and that's what I was thinking as I was reading through this. For me, I like the buckets that the recommendations are listed in. I think the recommendations are clear and pretty obvious what they're talking about. I like the way the progress is written. I think most of them do indicate like DOH or HCA or whoever else. Some do not. But I was also thinking it may be nice to have like a what's next kind of column or to-dos. There are things that still need to be attended to. One example I want to give is like on page 6 and 32, there's reference to work that HCA is doing with the ASOs, specifically on the 988 RCL policy statement and the regional crisis protocols. Like when I read the language that's written there, it sounds like those were done, but they're still in progress. So I think thinking about like what actually is done, and maybe it's just the lens of like when it was written at a point in time, but stuff that actually still is in progress and being worked on. And just one final like proofreading on page 4 with the acronyms, MRRCT is listed twice.
Thank you. Thanks for catching that. And Michael, it sounds like, if I'm tracking you, you in the progress section, and first of all, that you're suggesting that we have a what's next to really be clear about to-dos, but also to make sure that when we're talking about progress, we're being clear when there are things that are in progress rather than complete. So thank you for that catch. And we might, folks, we might need the we being the people that are writing the report might need to turn to some of you to get some clarity on that. So when you're sending in your written comments. If you see something like what Michael just caught about something that sounded like it was complete with actually still work in progress, please let us know, because that will help us make sure that we're being accurate in the language. I see Representative Dent was able to join. Representative Dent, would you like to take a few minutes to, what you missed was Senator Warnick, Senator Dingra, and Representative Orwell shared a little bit about their legislative priorities for 2025 related to behavioral health. They did share with us their concerns about budget constraints in the coming year. So we got an understanding of the reality of things. We'd love to hear from you, if you don't mind, what you're thinking about for the coming legislative session as it relates to behavioral health.
Well, thank you, Jamie. I appreciate that. And I apologize for being late. I had my wires crossed. I thought this meeting was yesterday. And I actually went on yesterday, and the computer politely told me it was tomorrow. But I already made an appointment for today, and I couldn't change it. So I apologize. But thank you for accommodating me. You know, behavior health wise, my major priority, and we've talked about it many times, and through this committee, we had a subcommittee on agriculture, and is the subject of agricultural suicide, and that is a priority of mine. I just continually see this, and I see the challenges increasing with our agriculture community, and how working on ways not only to try to prevent the suicide if it's imminent, but to go upstream and find the issues that are putting those people in that frame of mind to even consider suicide. And it's been something in my family, and the more I talk and the more I work on this subject, the more people are sharing with me that suicide's in their family, and especially in the more rural settings, rural community. So, and I have to say, I downloaded the report because I have a hard time reading all this stuff on the computer, and I haven't gotten all the way through it. It's really long. For a legislator, honestly, I'm probably not going to get all the way through it. I have other things to read too. So, that would be my thoughts on this report would be to, what can we not have in there and still make our point, right? But one thing that I do want to put in there, and if it's in here and I haven't seen it yet, then I apologize. But I don't see where we're taking a hard look at how we can help with the agriculture sector, in the suicide prevention and going upstream for mental health, agricultural mental health. And I don't see that. It was a big concern. We had a great subcommittee we worked on for a couple of years, and there was a lot of good things come out of that. A lot of people are really concerned about this, and as me, I am extremely concerned. Maybe I'm overly passionate. Maybe I'm not sure, but I would like to see a little more emphasis on that. And for a couple of reasons. Yeah, I'm a rural guy. Yeah, I live in this. That's the world I live in. But those are the folks that feed us, and we should be looking out for them, because without there's not anybody on this call that can do without water and food, okay, for very long, and then your life is going to change. And so I think that I would like to see a little more emphasis on that, and realize that folks in the agriculture rural sector, and that's more than just the farmer out there. It's the farm workers, and it's the guy downtown that sells the tractors, and the fuel salesman, and the folks out at the restaurant. When agriculture is not well, they're not well. Okay, so it trickles down to the entire community, and I'd like to see us kind of maybe take a look at that and how we can be there for those folks, because it is. I'm very concerned. And you've heard my story, and most of the people on the committee have heard me talk about my family and that issue. So I would like to possibly, as we go forward, make sure that I would like to highlight that a little more and make that a little more of a priority to take care of our folks in this sector of our country. It's and I don't know if I've talked about this. I do know that the agriculture sector has the highest rate of suicide than any sector in the country, right? The thing that bothers me more than that is it's 3.5 times higher than what's in second place. That's what troubles me the most, okay? So obviously the folks in second place are doing a better job of helping their folks, right? And maybe we need to take a look at that too. And that falls off on those of us that live in this world too. It falls off on me. And we do have a work group on agricultural suicide prevention, and we got a proviso last year. I don't know if Senator Warning brought that up today or not, but we have a work group looking at things that we could do to maybe alleviate some of the issues and concerns and challenges that we have in the agricultural sector. But we're making progress. I really believe we're making good progress because we're looking at some of the challenges. And I have to tell you, when we first started the committee, my idea was just, do we need to have our own hotline? A specific hotline for agriculture and rural people. And that was kind of what I was focused on a little bit. But now that we're further into it, I'm focused on that less, and I'm focused more on going upstream to find the issues, and how we can help people before they need to call a hotline, right? And although there are some folks on the committee now that are focused more on the hotline. So it's interesting as we learn and move forward how we all maybe get a different perspective of it. So something that I'm focused on. I'm considering some different pieces of legislation, but I don't know for sure yet because we still have a ways to go with what we've done. I'm hoping that we come up with some ideas before session, but maybe it'll be next year. I'm not sure. But we're working hard in that committee just as this committee is as well. So anyway, I do appreciate everybody on both committees that have given so much of their time in their lives and their efforts to find a solution to a very challenging and difficult issue. But it's a very necessary one, in my opinion. So anyway, I appreciate having this opportunity to visit with you a minute. Thank you. Thank you to everybody.
And thank you, Representative Dent, for being here. I'm sorry about the mix up with timing, but really grateful for you making it here and being able to share. And also really grateful to you for really taking the lead on educating all of us on the crisis in rural and agricultural communities and elevating that. Nicola and I were just chatting as you were talking in the direct chat because we developed the original draft, and your point about wanting to see more in particular about upstream and how we prevent suicide in rural and agricultural communities. On our next pass, we're going to go in and make sure that, or see where we can really make that stand out more. I know that's been a key priority for you, and I know for many other people in the committee. So thank you for raising that. I see Jane has her hand up. Hi, Jane.
Hello. Okay, so I want to preface these comments with two things. I was sitting in the rooms in 2009 and 2010 when there was that horrible recession, and Rep. Oral is nodding her head, when many of us were crying the night the budget passed because of what had to be done. And I've also spent a lot of years when I was a legislator staffer in rooms with legislators who were trying to figure out what to prioritize, especially in a budget environment like this. So a couple things. Number one, I totally agree that these recommendations should be divided to show which require legislative action, and not only legislative action, but which would require new funding, or as Senator Dingler said, maintaining funding. I see a fair amount of overlap between the recommendations. So are there themes that can be pulled out that, so in terms of, so I see a fair amount of overlap, and Jamie and Nicola, I'm happy to work with you because God only knows I've done this many times before. But I think, for example, having a category that says funding is sort of misleading, because if I go back up the list to the other 21 things, there are a bunch of things on that list that would require funding. And the other thing that I think about is, and I'm going to apologize because I haven't read the whole report, is if I were a legislator and I were a leg staffer and I were reading this, I would sort of be thinking on it from the perspective of, okay, wait a minute, right? They're mentioning telehealth. Don't we already cover telehealth services in Medicaid and commercial health plans? So what's going on with that one? So I think there are definitely different ways to present the recommendations. And also, Jamie, respectfully, I would say that we shouldn't make a statement that there's no way we're going to be able to prioritize these recommendations. I would suggest at least giving it a try of revamping the sort of the structure of the recommendations and how they're laid out, and then sending them out to the CRIS committee members, because you might not get pure consensus, but what you might get is, you know, it seems like a chunk of people focused around X, Y, or Z. Because if the CRIS committee doesn't take, and I'm happy to have legislators tell me I should go take a hike, but if the CRIS committee members don't take the opportunity to try to collectively voice some kind of preference or prioritization, then we're leaving it to legislators and legislative staff to make that decision. So that's my sort of real world perspective on this.
I so appreciate your real world perspective, Jane. Thank you for that. And Nicola and I can have a conversation about process after this and what's realistic in terms of sending back to you. I will say also to let you all know that that in terms of priorities, the work that we did was, you know, an attempt to use all of the conversations that we've had over the last 3 years, including the discussion we had in September, and reflect that in this document as your priorities. The reality is it still resulted in 22 recommendations, or 26. That of course came down from over 100. But Jane, I actually would love to maybe connect with you about what might be a good way to do this, given all of your experience. Also, I'm hoping some of the other comments that you made about how the recommendations are structured, if you could share some written feedback, I think that will really help us make another pass at this. So thank you for that. And thank you for sharing your wisdom and experience from years of doing this. I think this might be a good time. I promised you all a break. So I think this might be a good time to take a break, and then we can come back and continue our discussion. So why don't we have 2:17 right now. Why don't we take a 10-minute break? I know it's hard to do this without round numbers, but let's all plan to be back. Let's all plan to be back on camera at 2:30. You're getting a bonus 3 minutes at 2:30, and we'll continue our discussion about feedback on the report. So Christine, if you could just put it like a blank screen up that says back at 2:30 from break up on the screen, and everyone, if you could all be back on camera. There she did it. In 12 minutes. I'll see you soon. Enjoy your break. Okay, welcome back, everyone. Give folks a minute to get back on camera. Christine, if you don't mind taking on the break. There we go. Perfect. Thank you. All right, so folks, when you're back, if you could turn your video camera on, that will signal to me that I've got a quorum here. Excellent, thank you. I am going to miss seeing all of your faces. All right, so back to our discussion. Again, I would love to hear from others, maybe folks who haven't spoken today, from the CRIS Committee, your feedback on the report. Christine, would you mind just popping those discussion questions back up on the slide so I can remind everyone what our discussion questions were? So what I'm looking to you for is feedback on how the recommendations of the CRIS are presented, what changes we should make to convey the CRIS's recommendations more effectively, and your thoughts on one message you'd like every reader to walk away from this report with. And I want to open with a comment in the chat here from Bipasha. She says that dance between real and ideal is one each of us deals with in our own lives and at systems levels. That's the stuff of life. I appreciate the legislators giving us both perspectives, and I trust that we will all do the work we need to hold on to the real and ideal and land at optimal for the time at hand. So thank you for that, Bipasha. CRIS Committee members, and in particular, I'm looking at some of our members who haven't had a chance to speak yet. Any thoughts on the first three discussion questions there on the screen?
Yeah, this is Claudia. I think that I have a comment on page 13 when we talk about having, the use of translators, and it's also a comment where they talks about that we have over 240 languages available when you call 98. Gives you the impression that the services are there. Give you the impression that, oh man, we look at all the stuff that we have available. And I just talking to my team who are mobile crisis, who takes all the calls from 988, and any calls who come with translators, many times are getting dropped. There is a lot of issues. My manager expressed a lot of frustration with being able to really access interpreter services when they're out in the community. So I think it might be saying that's what we need and we're working hard to get there. It gives the impression to the reader there's still more work to do instead of kind of the way it sounds is like, wow, we achieved that. So that's my comment.
That is great feedback, Claudia. So make sure the language is clear that this is an aspiration, but we have not gotten there yet, and it's still really important.
Thank you.
Thank you for that. Anna.
Hi, yeah, my comment is regarding where it's for recommendations for services. And I'm looking at the more detailed recommendations for that and under specifically a place to go. And one thing I'm seeing is lacking is public outreach and public awareness to erase the stigma, because that's one of the biggest barriers of trying to expand crisis services or just inpatient behavioral health services anywhere is the NIMBY pushback. It seems like every single time a behavioral health crisis center or a behavioral health center is proposed, there's community pushback. In fact, it was in the paper right now that there is a crisis center that is planned for Colville, and the community is speaking up against it. And in a lot of these cases, unfortunately, the city ends up responding by not putting a moratorium or not having the facility altogether. And so if we're going to expand crisis services across the state, I think the state really needs to work on some type of an educational campaign to reduce the stigma around mental health and to educate the public of the help that these facilities can do for their own communities, because a lot of them seem to be under the impression that they're made for just city folk, and that all of the city people are going to come to their communities to use these facilities when it's actually meant for people in their communities.
Anna, thank you so much for raising that. And I recall that you've raised this in past discussions, this particular issue. And just to clarify for folks who read the report, there is a section that talks about communications to reduce stigma, but it does not specifically address the point that Anna is making, which is when you're trying to cite, and Anna, please correct me if I get this wrong, but when you're trying to cite facilities for people to go, the stigma that other community members hold where that might be cited can be a real barrier to actually making it happen. And so in those services areas, we do need to talk about addressing that particular stigma.
Correct.
Okay, awesome. Thank you. Bipasha.
I just want to piggyback on what Anna said with regards to stigma, which was one of the recommendations we made through the story project. I think, and also ties into what Rep. Dent said about upstream reasons.
Mm-hmm.
And I think stigma is one of the big reasons. So it's sort of, that what Rep. Dent said, what Anna's saying, and what we recommended, I think it feeds into the prevention part. As you go upstream, you're focusing more on prevention. And so I think that really needs to be emphasized in that section around stigma. But Anna named a very practical thing that happens due to stigma. So I appreciate that, Anna. Thank you.
Okay. So I'm just thinking about this because we're talking about stigma in multiple places. So stigma just for help seekers, and we talked about trying to alleviate the stigma for help seekers that prevents them from seeking help. And Representative Dent has talked a lot about that in rural agricultural communities. We're talking about addressing stigma in communities where facilities might be cited. And Bipasha, you're raising stigma when it comes to prevention and people getting the support they need upstream so that they don't even get to a crisis. So it sounds like we want to make sure all of those are covered in here. Okay, excellent. And Bipasha and Kristen, you actually, I don't want to forget about this either. You actually did some work after reading the report and after all the work you did on the Lived Experience Stories Project. You said you did some work thinking through an additional recommendation or two that you wanted to include. Would now be a good time to pop? Okay. And Bipasha and Kristen did a great thing, which is created actually a slide so that we can all follow along with what their thinking is. So Christine, would you mind putting up the slides that Bipasha, there we go. So I'm going to hand it over to Kristen and Bipasha to kind of walk everyone through their thinking here.
Yeah, so those of you that saw our Lived Experience Stories project presentation last month know that we had 7 insights. As a really quick recap, they were natural supports, follow-up and prevention, cross-system gaps, inconsistent quality of support, misaligned protocols leading to the lack of proper care, barriers to accessing care, and that the criminal justice system and emergency departments are functioning as access points to behavioral health care. Almost all of them have been discussed by the CRIS and mentioned in this report, including the issue of emergency departments. What we did not delve into as CRIS was in that Venn diagram where criminal justice system and behavioral health issues overlap. Although our study subjects were not a representative sample, 25 of the 65 stories mentioned involvement in the correction system. So we, Bipasha and I, are requesting that we add a 23rd recommendation to read as follows. The criminal justice system and emergency departments are functioning as primary access points to the behavioral health care. And I just realized I was supposed to pass this to Bipasha to read it. Leading to worse outcomes for people. This needs to be mitigated by establishing protocols to divert people from emergency departments and the criminal justice system to community-based healthcare. Also, when released from the criminal justice system, people have a hard time transitioning to care within the community, which may precipitate a behavioral health crisis that could lead them back to the criminal justice system. Protocols need to be established to enable a smooth transition for them. If we could go to the next slide, I'll pass it to Bipasha to read some of the quotes associated with this recommendation.
And I just want to highlight that I think our focus is more, this insight included EDs, but we've talked about EDs in the CRIS committee. So it's more focused on the criminal justice aspect. And these are the quotes that we would use to shore up that recommendation. My first day in prison was devastating to my psyche. I found myself in a world of which I knew nothing about. The fear and depression was contagious. It permeated every single day of my experience, which I believe became the catalyst for the subsequent drug abuse and mental health problems. Next quote, the major problem people such as myself face upon re-entry into the environment is the lack of fundamental resources to help you rebuild your life. The last two are actually from Lavani, who spoke to us earlier this year at the CRIS. My passion is number one, stopping people before they go into the carceral system through trauma services, through behavioral health services, prevention at school, in the schools, providing community for these children to have somebody safe to be, even to go to. And the last one, which sort of also captures the rural pictures, we incarcerate more rural America than anywhere else. And I did a little bit of research, and there is a report that actually substantiates what Lavani did mention. So I'll hand it back to you, Kristen.
We did notice a mention of the criminal justice system in the services section. It reads, CRIS members recognize that many people currently access the system via emergency departments or through encounters with the criminal justice system, and underscored the importance of expansion of behavioral health crisis services to provide a more equitable and trauma-informed response to people in crisis. But we wanted to give this issue its rightful place by moving it from just an observation of the CRIS to an actual recommendation that we should do something about it. We know this is a challenging ask as we talk about our current budget situation, but we feel that this is something that affects many of our most vulnerable and marginalized community members, and touches upon some of the issues we talked about earlier in our priorities of protecting the most vulnerable, of focusing on rural and agricultural communities. So we think it's important despite the challenges that we're facing. We don't have anything to put in the agency and legislative progress columns necessarily, but that is true for some of our other recommendations, like the Collar Bill of Rights. And although we haven't delved into behavioral health and criminal justice system overlap on the CRIS, one of the goals of establishing and building out 988 and all its pillars is to divert people away from the criminal justice system. So we think this is a relevant recommendation to add. So we'll leave it up to you guys to debate and let us know what you think. We think it could fit either under promoting equity or prevention in the report. We feel like prevention might be the better place for it, but it's definitely, of course, up to all of us to decide whether this is something that should be added. Like, I already see Puck has their hand up.
Before you speak, Christy, could you just flip up to the previous slide so folks can see the actual recommendation again? The one, sorry, there we go. Perfect. Okay, Puck, please jump in.
Yeah, I also wanted to speak to just a little more context. I'm going to zoom us back out a little bit from the specific recommendation for a second. Yeah, we got here talking about diversion from law enforcement response to mental health crisis. And throughout this process, it was a little challenging, not challenging, but just like paradigm shifting, because Michael Robertson was only able to get clean from drugs, that's a terrible word, to stop using drugs with the support of being incarcerated. And my partner's Oxford house, most of his housemates there all were incarcerated, and that was a big part of their recovery because we are lacking so much in other services. So to me, that is a frustrating fact, but also a important fact that we recognize that these are some of the sites that are doing some of the work. And also what we've heard, that this bottom section of people having a hard time transitioning to care, I think a lot of people know about, but maybe not. Maybe a lot of people don't know. Often when people are released from incarceration, they are released without many resources, you know, like we're not setting them up, we're not getting them transitional housing. Like often it is, you have to have housing, you have to have a job in order to stay out of jail, but we're not really going to provide you any supports to do that. And so when there is mental, or when there is behavioral health stuff involved with that as well, a lot of times people don't have their records, or they don't have the capacity to hang on to their records. Like, there's so much stuff there. There's so many layers of work that people have to do, that when you're already just trying to work on stabilization and work on building a new life, people have a hard time is an understatement. So I just wanted to bring that up as well. That's something that I heard coming from the Stories Project, and also something that I've heard from other people's stories as well. Thanks.
Sorry, I did it the one time. I'm going to try not to do it again. I was talking on mute. Thank you, Puck. Okay, so just to clarify the recommendation here, the specific recommendation I see here is to establish protocols to enable a smooth transition for people who are moving from the criminal justice system out back into, I don't know the right terminology, but back outside of the criminal justice system, so that they don't find themselves likely to run into a behavioral health crisis.
It's two parts. The first part is to try and divert people into non-criminal justice system based programs when applicable before entering the criminal justice system.
Okay.
We know that there's a lot of people that do get that support within the criminal justice system, but it would be better if they could get that support in their community instead of getting it while incarcerated. So finding a way to divert folks into those sorts of programs before they end up involved in the criminal justice system. And then the second half of it is for folks who do get involved in the criminal justice system and do get some of that support while they're there, making sure the transition back out into their community goes smoothly, that they're connected with someone that can continue prescribing them medication or keep giving them the kind of therapy that they were receiving, things like that, because we did have a lot of stories where people started behavioral health treatment while incarcerated, but then when they were released, they didn't have those connections to continue those services, so that they didn't end up going back into the carceral system.
Thanks for the clarification, Kristen.
Mm-hmm.
And I want to add, I actually have a note here that was forwarded to me from one of our newest CRIS Committee members, Tori Gildred. Just a thought, the 1115 waiver is focused on this exact issue, jail transitions and behavioral health access, something to highlight when we think of what is in progress. So that's a helpful context, I think. And I saw Senator Dingra and Puck nodding there. And I apologize. I think I have a CRIS Committee member on here, and I believe this is a CRIS Committee member. Your Zoom says WA DCR Association. So I just want to make sure. I saw you raise your hand earlier, but
Yeah, this is Laura Pippin, and
okay, Laura, thanks so much. I just wanted to
Yeah.
confirm. So please jump in here.
Yeah, and again, I apologize. I'm the president of the WA DCR Association, and I get lots of feedback from DCRs across the state. The transition from our conversation, I'm moving to a different, so if you want me to wait, I will.
No, please. Well, actually, yeah, let's hold on one second. Let's finish up this and then I'll come back to you, Laura. But thank you for clarifying. So everyone, that's Laura Pippin, one of our CRIS Committee members. All right, so CRIS Committee members, I know we've been talking about paring down, but I also acknowledge that this comes directly from observations from the lived experience stories, and Kristen and Bipasha worked really hard to formulate this recommendation. Any feedback from other CRIS Committee members about inclusion of this recommendation with our other 22? And I see Bipasha and then Senator Dingra. Bipasha?
I just want to clarify, I think our intention is to focus. I know that the slide says and emergency departments, but this intention is specifically around criminal justice. So, you know, we can always play with the words on this. This was something we did for this meeting, and just say the criminal justice system is functioning as a primary access point, and how do we, change that? So I just want to clarify.
Thanks for that reminder, Bipasha. Yeah, that's great. Senator Dingra.
I'll rather have Darcy go first since I've spoken quite a bit and she hasn't.
All right, let's go with Darcy and we'll come back to you. Darcy. Darcy, you're on mute.
Sorry. My only thought about that is that we make it really clear that a recommendation for people in the criminal justice system isn't going to take away resources from people who aren't in the criminal justice system. It's been my experience that when trade-offs have to be made in the funding world with our government, that often it goes to the criminal justice system and reduces resources to the community. So I want to make sure that we have some kind of balancing metric in that regard.
So Darcy, I hear you saying that recognizing maybe some of the information we got early on in this meeting today about the budget constraints, you want to make sure that we're not suggesting that we reallocate resources from serving people outside the criminal justice system into the criminal justice system.
Right, yes.
Okay, all right, and so that it would be good to say that explicitly. Okay, thanks for that feedback. Senator Dingra.
Thank you. I just wanted to make sure you hear clearly that I absolutely think this recommendation should be included. Even though we talked about paring back, I think we can prioritize them. I mean, the bottom line is our largest mental health hospital is currently still our prison system. So I think this is a key recommendation if you're switching systems. So I absolutely, if you need a motion to include it, I'll make it.
We haven't been that formal in our process, so
never mind.
If anyone wants to jump in and push back, but I'm generally hearing support for including this. Bipasha, do you want to push back?
No, I just wanted to say, Darcy, I think the recommendation here is to keep the resources within community mental health, so if people are getting the help they need within community, that will help them, some of them not fall into the criminal justice system. And then once they come out of the criminal justice system, they have the resources within community mental health to get the help they need. So it sort of reinforces what you just said, Darcy.
Yeah, and I just wanted to, we want to be clear, we need additional resources to do this, not reallocated current resources.
All right, and then I have a comment in here from Michael Reading. Is it appropriate to note that there are some services that speak to both of these? The Recovery Navigator program does divert from jail, and all ASO regions have a jail transitions peer pathfinder to help with transition from jail to community. So I didn't know that, Michael, so thank you for that. Blaze. Hi, Blaze.
Hello. Yeah, sorry, I can't seem to get the camera to work, so my apologies. I'm technologically disadvantaged. So some of the things, at least down here in Clark County and Vancouver, we do have a really good relationship with certainly with our co-responder program and the recovery navigators, but we've also just recently set up community courts. And so while it is, criminal justice, yes, but it is solely designed at keeping people really out of the system and getting them into the help that they need. And we've had a fair amount of success as a community with that. And I don't know, not everybody is as fortunate as we are. Not everybody has the resources that we have down here. But that is something that probably other communities could benefit from throughout the state, is looking at some models for community court and that sort of thing. And it's typically, when mental health is the driving factor for the low level criminal behavior, we're having a pretty decent success rate at getting people into services that will help correct that.
Blaze and Michael, thank you for jumping, and Tori, thank you for jumping in with all of these insights on actually where there might be opportunities or progress in this particular area. And I'm just going to say, I think Nicola and I might be following up with some of you to get a little more detail to build out that progress section that would accompany this additional recommendation. So thank you and it's good to hear, actually.
Yeah, and then I guess just one more thing about, and I'm not in corrections, and so I'm not necessarily the person who knows everything, but I do know that we've struggled when people are getting released from jail. Sometimes they get released at pretty different times, and there's not always that warm handoff. And that creates some real challenges, because without that warm handoff consistently, because sometimes they go back into jail, right? But it's that consistent warm handoff, because if it's not there, the majority of these folks go right back to where they feel comfortable, and it's not a very healthy environment most of the time for them. I think from a state perspective, if there could be some consistency within the corrections division, if somebody's been diagnosed with some sort of mental health issue or is on medication, if there's some way to ensure that across the state that they get that handoff, that would be really helpful.
So Blaise, if I'm hearing correctly, it sounds like your recommendation is maybe to modify the text that Bipasha and Kristen proposed here to, for example, in the section talking about establishing protocols to enable a smooth transition for people coming out of the criminal justice system, including a warm handoff, a consistent warm handoff.
Yeah, I think that consistency would be key.
Okay.
It's not unusual to have somebody come out of jail with some sort of, either substance use disorder or something else going on. And if they don't have that warm handoff, they can't get their medication, number one, right? They don't have a clean path. So they go right back to where they came from. And that's typically not a very healthy environment.
Yeah. Yeah. Thank you for that. And thank you for the insight based on your direct experience. Let's go to Kristen, and then I want to go back to what Laura Pippin was going to raise. Kristen?
Yeah, I'm really glad to hear about some of the programs that are working for this area. One of the things that we talk about a lot in lived experience is making sure that we're not just talking about what we need to add, but also what we need to make sure continues to be funded. And that seems really relevant with our budget discussion. So I'd love if we could add some of that to the wording of this recommendation about continuing to fund the programs that we know are working towards what this recommendation is hoping for, and finding ways to try and expand these programs that are having positive impact into more communities that don't have them yet.
That's a great, Kristen. And I think we've gotten some very good detail in this conversation. Like I said, it would be useful probably for Nicola and me to do some follow-up with some of you to make sure we're really clear about what to put in here. And I want to add a note here from Bipasha. What Blaise brought up is what we heard in the stories too, of people not getting the support they need. So they end up going back into the criminal justice system, which is really a lot more expensive. All right. Any other comments on this particular recommendation before I move on to Laura Pippin's feedback? Okay, Christine, if you don't mind taking down the slide. Laura, thank you for your patience. Please jump in with your thoughts.
Thank you. And I apologize. I waited a little bit, making sure my voice added to the conversation. As we were speaking about licensures, as I was saying, a lot of the DCRs from across the state have been emailing and calling with concerns of the new licensure standards for MHPs. As that has gone through, agencies have determined that an MHP can be a DCR. And when we look at the listing that the Department of Health sent out for licensing for an MHP, we have individuals that have no degrees going into social services, no degrees with diagnosis, unable, because of lack of skill level, really, to differentiate between whether something's substance abuse, something's mental health, or something's medical. Before, when we had the RSN, it stated in the protocols, and I've tried to look through it with the healthcare authority, that a DCR would have either a psychology or a social service degree. And with those, people are trained in diagnosing, in the insight, the difference of between the diagnoses and what they're seeing. And that is not happening anymore with all agencies, as we've been looking to try to hire people. So yes, an MHP criteria is an MHP criteria, but I think a DCR who is reading someone their rights and needs to have the insight and judgment themselves whether this person is at risk or needs detained, someone with the appropriate skill level needs to be doing that. Someone with an administrative education degree, we feel, should not be detaining someone because they don't have the actual capacity to assess whether this is a risk to, on a medical level, like diabetes or thyroid or UTI, whether it's some substance abuse, whether they're under some kind of alcohol or fentanyl or meth, whatever's going on, or whether this is truly a psychotic episode or a suicidal episode. So as I looked at the licensing part, we would suggest a protocol that holds the DCR to a higher standard, because they are making decisions with our most vulnerable population. And it is important, as we see it, that the licensure is appropriate to the skill level of the job. Does that make sense?
Yeah, Laura, but maybe you could help me out a little bit, and I apologize because I don't have the whole report memorized. Can you help us with which recommendation in particular you're talking about?
The licensure recommendations. I'm in my car right now. I
Okay.
had to leave, but it was under the licensure recommendations when it was talking about the different kind of licensures. So again, the DCR board and stuff, they asked me to suggest this or to at least make the CRIS committee aware of this. As we're going forward, we need to make sure that skill level is appropriate to somebody having their rights removed.
Okay, okay.
I can look it up when I get back home and send the part to you. I apologize for being mobile and multitasking.
No, I'm actually really grateful for you making time for this call, despite the fact that you pulled in a lot of directions. And Nicola, I'm going to ask if you could kind of look up the one that Laura is referencing and see if you can track that. But Laura, just in general, what I'm hearing you say is the feedback you're getting from your designated crisis responder community is that the expectations or requirements need to be appropriate to the job that the person's doing. And so in a situation that has as much complexity as a DCR's job, which involves potentially involuntary treatment, we do need to have certain your community saying that there are certain standards that need to be met in order to do that job appropriately. Am I hearing you right?
Yes, correctly. I mean, there's a lot of responsibility that goes along with it. And when your counterparts with people that don't have the skill level and are walking through, there's a lot more responsibility on you. There's a responsibility for you with the person that you're being present with in front of you. And then there's a responsibility to make sure your partner is doing things appropriately. So it adds to it. So again, just the consideration that like I say, that the licensure is appropriate. And I do know we need MHPs, and I do know we need peers and the crisis counselors. But when you're looking to that higher level of, like I say, assessing someone for risk and making those decisions, whether it's mental health, substance abuse, or medical, teasing out what is there, you need someone appropriate in that position that is not doing harm to that individual. So, because we don't want any DCR removing someone's rights just because they're not sure or clear. That is the feedback we are getting from our DCR community.
Okay. Thank you so much for sharing that. And thank you for checking with your DCR community about the feedback. And Michael reading says, I think this refers to recommendation number 16 and how the progress statement is made regarding mental health professionals and mental health certified professionals. So thank you. Thank you, Michael, for jumping
And
in.
I believe that is correct.
Yeah, that's
Thank
great.
you. Thank you so much. And that is, yes.
I'm sorry, could you repeat that, Jamie?
Yes, Michael says, I think this refers to recommendation number 16 and how the progress statement, and someone correct me if I'm getting these acronyms wrong, how the progress statement is made regarding MHP or mental health professional and MHCP mental health certified professional. Michael, jump in here. And thank you.
Yeah, just to answer that. So just to clarify, so if I'm understanding what was said, which I think is a good point, the agency and legislative progress for number 16 talks about how House Bill 1069 addressed mental health counselors and the different nuance about how someone could be considered an MHP. But then when DCR agencies think about hiring a workforce of MHPs, it does make a difference well, I guess it makes a difference, right? In terms of like the MHP as like the traditional MHP versus the new iteration of an MHP in order to do the work of an IT evaluation.
Correct. Thank you so much.
Michael, could you say it, and apologies, I don't have the report right in front of me. What bill number was that again that we referenced in there? 1059?
1069.
1069. Okay. Tisha, you got that? 1069? Okay.
Got it. Thank you.
Thank you, everybody. It takes a village. I appreciate it. All right. We're getting close on time here. Any other, this was actually a really robust discussion. So thank you, everyone. I feel like, Nicola, I hope you're feeling this too. I'm feeling like we're getting some really, really great and helpful feedback to do the next pass at this report. Any other final comments on, and don't forget, of course, we're also looking for written comments, end of day, the 18th. So please, please also feel free to send anything that you think of after this meeting in written comments. And I see Nicola giving the thumbs up. Any other feedback on the report? Darcy.
Hi, so just one thing to consider. I know that in the report, often the emergency departments and criminal justice are like hand in hand in the report. And I really feel like they're really different environments. So if there's a way to separate out the ERs, which are the repository of everything that doesn't work in the system, you know, behavioral health is just one of them. And so I really feel like the tone of the report when it came to the emergency departments was really negative. And even the lived experience stories were all about bad experiences, and maybe that's for a reason, but it doesn't seem very balanced in that regard to me.
So Darcy, I'm hearing you say two things. One is to make it clear that there's a distinction between the emergency departments and the criminal justice system. And two is to acknowledge or understand that emergency departments and a lot is being thrown at them, and that it's a systems problem. It's not that it's the emergency department's fault that this isn't going well for people.
Yeah, and the other thing I would just add is that there are times when someone with a behavioral health crisis or emergency should go to the emergency department. So I don't want to give the impression that there's, you know, that the diversion is always appropriate.
Thank you, Darcy. Blaze.
Yeah, I just kind of wanted to touch on the relationship between law enforcement and the hospitals or the ER specifically. For most places in the state, right, that's the only place at certain times on your shift that we, law enforcement, can take somebody. So unfortunately, right, that the ER is the repository for this, and I mean, that shouldn't be their primary job. And they are really having to balance that, and it creates a ton of friction within the community. And because when law enforcement doesn't have a place to take somebody that they're dealing with, right? Because if jail's not the answer, then where do we take them? And so we frequently take them to the ER, and it's not ideal by a long shot. And we can have severely impacted people that we're dealing with, and it frequently throughout the state, the only place that we law enforcement can bring them is the ER. So it's just a automatic point of friction because it's really not great.
Yeah, Blaze, thank you for raising that. And that is definitely something this group has talked about a lot, is that ERs have functioned as sort of the place of last resort in a lot of cases, or in rural areas with fewer services. Sometimes these are places that are the only option. So much of what we've been talking about, CRIS Committee as a group over the last few years, is how we make that less so, and in situations where people go to ER, what can we do to make it work better? And I think, to Darcy's point, when we take the next pass, we should make sure that that's really clear in the language. So we're not giving the impression that ERs are falling down on the job in terms of supporting people who are coming in with behavioral health crises. So thanks to both of you. And Blaze, yes, thanks for reminding us too of that context for law enforcement. Bipasha.
I just want to emphasize again, like I did earlier, our recommendation pivots more heavily on the criminal justice part. So as we word that, we're fine removing the emergency departments, and we've had a lot of conversation around EDs already. And of course, as I hear this, I'm thinking as the 23-hour centers sort of get built out and fall into place, that they will be where even law enforcement and people can go. And the whole point, from what I remember from the bill and what we saw in Arizona, was if there is a need for medical care, those centers will let people go get the other medical care they need, and then come back to the 23-hour centers, which sort of covers what you said, Darcy, is that in some cases, behavioral health and other health issues can overlap and need to be attended to. So just want to clarify, we can move the ED part in our recommendation.
We can do both. We can remove the ED part in your recommendation, and we can go back to the other places where we mention the ED and make sure that we're addressing Darcy's point.
And I just really quick want to say, we tried really hard to represent the stories. This is not Kristen and my story. So if people are talking, and you know how it is, we often, me included, when I'm mad, I will speak up. When I'm happy, I'm just like going around life. And so I think that's what happens with consumers, is when they don't have a good experience, they're more likely to speak up. And by no means, I know we as lived experience don't believe that the EDs aren't doing the best they can do anyway. So just want to acknowledge that. Thank you.
Before we move on to what's next, I do want to open the forum to this group. If anyone, when I was meeting with Representative Orwell last week, she mentioned a question of if anyone wants to share, since we are kind of at the end of this stage of the CRIS, if anyone wants to share any reflections on this process, their experience, what this experience might have meant to you or your networks, any feedback, constructive or positive. I do want to open the lines of communication on that as well. So the last question I had for you is there anything you want to share about this experience, whether you've been part of this for the last 3+ years or you're fairly new to it? Anything anyone wants to throw in there? Kashi.
Thank you. I think that I have really appreciated the ways that the seeking and centering of lived experience has been done throughout this process. And I don't say that to imply that there isn't more that we can and still should be doing, but I appreciate how much work has gone into hearing from those most impacted by this crisis system and how we can make it better in response to their feedback. And I think that it is always ambitious to think that 3 years of work, well, maybe I'll speak for myself. I have big ideas about what one can accomplish in 3 years, and I recognize that we've done a lot of work, and I know that there's still a lot of work to do, but I really appreciate the foundation that we get to work from here. So thank you.
Thanks, Kashi. Vipasha.
Just want to highlight what Kashi said. I really want to give a hat tip to the legislators that centered lived experience. That is where it started. Let's, and a lot has happened since, but we need people like our legislators to say, hey, we need the voices of lived experience in all the spaces that they are doing their work in. So I really want to tip my hat to both Senator Dhingra and Rep. Orwell. And I have never served on a government committee before this. It's been quite the ride. I've learned a lot. My panic attacks for the first year have settled down now. But I think I just want to speak on behalf of the Lived Experience Subcommittee. So this is not me, but I think the people in the community have really found this space very helpful, especially the space where they can speak, and the agency folks who attend the meetings, and thanks, a lot of them are at this meeting, for coming and listening to the community, interacting, and even responding and following through on certain things that happen. I'm going to say this as Kristen, this is an example Kristen brings up, where we had one lived experience person talk about how there were 4 transfers before she got to talk, and that took like 20 minutes, by which time the crisis at hand with her child had sort of, diminished. And they looked into that, and they found out that what happened is that the call went outside the Washington state system, and that sort of led the move to, like, okay, if, let's say, Crisis Connections can it go to VOA? Can it go to Frontier and stay within the state? So this is a very tangible example of what the lived experience space has done in terms of impacting the system for everybody. And again, the hope is that we continue to be involved in, our voices continue to be involved in informing any systems that are built out, be it behavioral health or anything else. Thank you.
Thank you, Vipasha. Michael.
Thanks, Jamie. So just not to miss a chance to reflect and just say a word of thank you to so many different folks that made the CRIS Committee possible. Started with Senator Dhingra and Rep. Orwell, who are truly champions for crisis services and helping to even bring us all together and make this happen. Thank you to you, Jamie and Nicola, and all the folks at HMA for shepherding us through this whole 3-year process with all the documentation, keeping us on task and accountable, and just everything you've done. Because I think it's been so worthwhile. I've appreciated being a voice for the ASOs, to be at the table and to speak about the work of crisis services in our region in Western Washington. And I've learned from others on this committee, just because I'm just one of many other stakeholders who represent so many different facets of what it means to support people in crisis. So thank you.
Thank you for the kind words, Michael. Truly appreciated. Any other thoughts from folks before we move on to what's next? All right.
Oh, Jamie, I couldn't find my hand quick enough.
Please jump in.
I was just gonna thank the group for all the incredible support in the subcommittees and in this space as we did the implementation of this really heavy lift, this national lift of 988, and all the opportunities to get input and think about how to guide the work, to make sure we're centered in the right places, to hear from so many different stakeholders has been incredibly helpful throughout these first 2 years since we've been live, 2.5 years since been live, and all the planning leading up to that. So just a lot of gratitude for all the wisdom and guidance and opportunities to continue to improve.
Thanks, Michelle. Thank you for jumping in there. All right. Before I turn it over to Tisha to talk a little bit about what's next, I do want to just make a last call. Community members, if any of you would like to make a public comment today, this milestone meeting, please send a chat to Christine Milana. She's taking down, right now we don't have anyone signed up, and I've got 20 minutes for you. So please sign up if you'd like to make a comment today. And Christine will give you the guidelines. And in the meantime, I'm going to hand it over to Tisha, who's going to talk a little bit about HCA's thinking about what's next for the CRIS Committee in 2025. So Tisha.
Hey everyone, can you guys hear me okay? Wonderful, thank you. Just a quick introductions for folks who might not know me. I always think it's a good idea just to start at any meeting. Hello all, I'm Tisha Kirschbaum, the director at the Division of Behavioral Health and Recovery at the Healthcare Authority. You guys might remember that the reason I'm on the agenda right now is because I believe at the end of January, the contract that HMA has to do the facilitation of the CRIS and kind of the wrangling of all of us with the support they give to the subcommittees and getting the reports written and all of that is going to be ending. And then this work is transitioning over to the Healthcare Authority. It's going to look a little different in the future for a multitude of different reasons, but I think probably also because, the final report is being submitted, and then we're moving more into kind of a ongoing status update and giving implementations from the agencies, if I understand it correctly. So some of the things that we have been doing to assist with this transition is having some ongoing meetings with HMA to talk about administratively and operationally, what have they done, and then to better understand what the Healthcare Authority can do for facilitation with the available resources that we'll have for this moving forward. I think it's so I guess I just wanted to thank HMA for their ongoing support and partnership and facilitation as we make this transition. Michelle and I have also been working really closely with the Lived Experience Subcommittee and also with Kristen and Bipasha and Puck to think about I think we're all in agreement that the perspectives that part of what has made this process works so well is that we have centered it in hearing from people with lived experience, people who either themselves or their family members or their loved ones have participated or utilized the crisis system. So what can we do to make sure that that same intent is continued on into the future? It might not look exactly as what we have right now, but what are the areas that we can commit to and continue on with the resources that we have available to be able to make sure that we continue to center this work in people who have actually received services, making sure that that voice continues to be heard at each of the future CRIS meetings. Not 100% positive what that's going to look like yet, but we're having those conversations. We are committed to making sure that that continues. Exactly what it looks like, we're not quite sure yet. A couple of concrete things that we're leaning towards at the moment when we're thinking about what the next couple of years will look like as the Healthcare Authority does the facilitation of the ongoing CRIS committees, probably quarterly meetings. I think we're really leaning towards probably having them in person in the Olympia area with probably some type of a hybrid option. Also looking at probably starting the first one after the legislative session gets done this spring. And then making sure that somehow we continue on with ensuring that a big part of these meetings are making sure that we hear from people with lived experience. Really open to hearing people's feedback or thought. I think we're really still kind of in the planning phase at the moment, and thankful that we're able to have this time on the agenda to give an update.
Thanks, Tisha. So now we have a little time for Q&A or feedback. Tisha asked if anyone has any initial thoughts here or questions for HCA about what's next. So CRIS Committee, sure, your time. Anna?
Just curious what that CRIS Committee that potentially might be meeting quarterly is going to look like. Is it people that are already on CRIS now? I'm just kind of curious what the makeup of that group is going to look like.
That's my understanding of that. It would still be the current CRIS members. It's just the facilitation is moving from HMA doing the facilitation over to HCA.
Other questions for Tisha? So Anna, just to sort of build on your question, is some of the question like, what is the expectation of current members about the continuing commitment to this?
Oh, were you asking me if
No, I
that
was
was
just
part of my
asking
question?
if that's part of what's part of your question, like, should I be, as a CRIS committee member, should I be thinking about needing to plan to be involved quarterly in the coming year? Was that part of your question?
Well, I guess, yes, kind of, but I mean, I plan to continue, I guess, but I mean, sure, just that I can ask that question.
No, I actually didn't mean to put words in your mouth. I just wanted to make sure I was tracking you. So please correct me if I'm not going in the right direction.
We hope everyone continues to be active members.
Vipasha.
Okay, so if the CRIS members as they stand today are going to continue to be CRIS members, regardless of whether we meet more often or not, I just want to say that the CRIS committee has 4 lived experience positions, and we've been without the 4th one for a long time. So 1 position. So Tisha, maybe we can work because in the past HCA has led the role to fill that position, and we need more marginalized voices in this process. So we'll continue to work with you, because I was not sure. I was like, oh, if this is ending, is it, because it took a lot of effort to have those people, but if it is going to continue for the next 2 years, regardless of how often we meet, I think that position needs to be filled. So thanks, Tisha.
Good point.
Puck, did I see your hand up?
Yeah, that thing that Vipasha said, I wanted to say, and also just in the initial bill, there was a lot of intention put into establishing who would be on the committee. And as we are transitioning to this new format, I think it's important to make an intentional decision whether we're going to continue following that and making sure the communities that are spelled out to be represented are. I think we went a long time without an LGBTQ community representative because that was hard to fill. And so I think that's something that HCA has worked hard on, or HMA has worked hard on, that HCA might be not realizing it's picking up that labor as well.
Thank you. That's good feedback, Puck.
And I have a note here from Anna saying along those lines, it would be nice to have someone from the rural agricultural community to fill the 4th lived experience role. So thank you for that. Any other questions or feedback for Tisha? Kashi.
I feel like I always got to stick my hand up and say this, but there was never technically a pediatric subgroup or subcommittee. And I think part of that has to do with the same reasons we should have LGBTQ representation on every single one of the subcommittees, right? In reality, in an ideal world, we'd have someone representing the rural and agricultural community on every one of our subcommittees, and the same for pediatrics. But I guess it's more of an ask about what can we do to keep the youth population top of mind as we transition this work, especially recognizing there's a lot of real needs in the crisis system for our youth. So thank you.
Thank you, Kashi, and you've played such an important role in keeping youth top of mind for this committee. So thank you for that. Senator Dingra.
I just want to do a quick reminder that we actually have a youth and children's behavioral health task force that we coordinate with. So they have actually gotten their own task force. But yes, I agree, we should be incorporating all of these voices, but I wanted to make sure we did not forget to say that we are indeed focused on youth and children as well. And that coordination between that group and this group is key. And thank you, Kashi, for being that bridge along with others in that work.
Any other feedback from CRIS committee members?
I see a hand by
Oh,
family.
I don't think that's a committee member.
Oh, excuse
Yeah. Okay. All right. Christine, have we gotten any signups for?
No signups for
Nope,
public comment at this
okay.
time.
All right, well, then let's just go into action items. The next, oh, Huck, you want to jump in?
That person that wanted to, sorry. I was just wondering if that person with their hand up might be reached out to see if they want to do public comment.
Yep, I was going to ask Christine to do that. Christine, do you, I saw Donna put their hand up, so if you don't mind just reaching out to see if she'd like to make a comment, that would be great. And any other community members, we do have time, so please send a chat to Christine if you'd like to make a comment. All right, and in the meantime, I will do action items and next steps. So first off, just a reminder, and Nicola, please correct me because I realized I wrote down Monday, November 18th, end of day, but Monday is actually the 19th. So is that correct? End of day Monday for written feedback on the draft report from our CRIS members?
Yes, that would be great.
Okay, so everyone, please mark your calendars. CRIS committee members, if you have not sent your written feedback, please do send it by end of day on Monday, the 19th. That will give us time to turn it around and do a revision that will go to the steering committee for approval at the December meeting. I also want to make a note that this report is actually going to have a letter from the steering committee opening it. And so steering committee members, we're going to send that draft to you on this Friday, November 15th, so that you can provide feedback. We have a draft for you to react to, and we're going to try to incorporate some of the themes that came out of today's meeting, especially into that to highlight. Oh, Monday is the 18th. Okay, I'm sorry, everybody. I'm clearly off. Monday is the 18th. Thank you, Nicola. Trying to multitask here. Are there any, Nicola, are there any other action items or next steps that I missed?
You covered it, Jamie. It's really, we'll be working to address each of these comments raised and following up with people to help clarify, but appreciate all of the discussion and feedback today. Really, really helpful.
And then I just want to make one last plug, which is a few of us have been trying very hard. We would really love to have the voice of a young person in our personal stories, recognizing that this may not be a forum that someone under 18 would want to come present to necessarily. We maybe there is, but we'd also like to broaden that to maybe a young adult who had experiences with the crisis response system as a young person. So if any of our CRIS members or community members have ideas for where we might be able to source a story or a young person who would tell their story, please get in touch with Nicola and me, and we will take it from there. But it would be, if we could do that at our steering committee, I think that would be really meaningful. Bipasha.
I just wanted to add, I know our meetings in the middle of the day, school day, so-and-so. So if there is a person below the age of 18, we would invite them even to do a recording, like a video recording, and play that as a story, because at these meetings, we don't interact with the person who presents. We're not allowed to ask them questions. So if the person wants to video record something and send it, we can play that, and we can work with whoever wants to do that to help that happen. I know HMA will support that also.
Pasha, thank you for adding that note. All right. We're going to move into public comment momentarily. I do want to, before we do, just say that it has been an absolute privilege to work with all of you these past 3+ years. done a lot of these, and this was a particularly thoughtful, engaged, kind, committed group of people. And I know, to Kashi's point, 3 years was a lot of work, and it still feels like there's lots to be done. But when I look at how it's all synthesized in the report, everything that you've thought about, all the progress that's been made, all of the thoughtful recommendations you've come up with as a group, I feel very, very proud of the work that you, the CRIS, have done these last years. And I'm grateful to have been on this journey with you. So I will miss seeing you monthly, but I plan to come be a fly on the wall in your quarterly meetings and see how things are going. And just really, really grateful to have had this time with you. So thank you all for all of your work and commitment, and for fighting the good fight. And carry on, keep carrying on. Let's move to our public comment. We have so Donna, who raised her hand. Donna, I apologize, I don't have your last name, has said she'll do a public comment. I'm just going to remind everyone of the guidelines. 2 minutes. Christine's going to put a timer up for you to keep track of your time, Donna. And the CRIS Committee is going to listen but not be responding. And if you have any written version of your comments, please do send that to the project email box. We'll put that in the chat for you. And so, Donna, if you could just start by saying your full name, and then
Yeah,
we'll
Donna Obermeyer, Obermeyer. And I don't expect to take 2 minutes, but just want to comment on our Thurston Mason MRSS, Mobile Response and Stabilization Services, and emphasize that they do not ask for any justification for a crisis call. And I think that's part of why they're successful. Doesn't matter if you already have been receiving services from another entity. Doesn't matter what insurance you have or don't have. They just go and they help. And so I just want to, I hope that that's, I've heard that some other counties ask for, oh, there's a form, or they ask questions about why you would want crisis services. And so I think it's just a good model to say you don't have to justify why you're calling for help. So that's it.
Thank you,
And
Donna.
Catholic Community Services is the provider in our counties.
Thank you, Donna. Appreciate you closing out our meeting today with your comment. Community members, anyone else would like to make a comment? We do have a little bit more time. You can just raise your hand if you'd like to speak today. Okay, well, as a farewell gift, I'm giving you 23 minutes back in your afternoon. Please do join us for the steering committee in December. Nicola, what date is that? Remind me, is that the 13th?
It's December 10th.
December 10th. Okay, December 10th. For our steering committee meeting, our final steering committee meeting of this cycle. So everyone, please stay in good health and be well. And I hope our paths cross again. Take care, everybody. Have a good rest of your day.
Thank you, Jamie.
Thank you.
Thank you, everybody.
Thank you, Jamie.
All right.